Psychologists and others have struggled for many years to establish an effective definition of the term stress. This term is used loosely today and still lacks a definitive explanation. Stress may be viewed as an individual's reaction to any change that requires an adjustment or response, which can be physical, mental, or emotional. Responses directed at stabilizing internal biological processes and preserving self-esteem can be viewed as healthy adaptations to stress. Roy, a nursing theorist, defined an adapt response as behavior that maintains the integrity of the individual. Adaptation is viewed as positive and is correlated with a healthy response. When behavior disrupts the integrity of the individual, it is perceived as maladaptive. Maladaptive response by the individual is considered to be harmful or unhealthy. Various 20th century researchers contributed to several different concepts of stress. 3 of these concepts are stress as a biological response, stress as an environmental event, and stress as a transaction between the individual and the environment. This chapter includes an explanation of each of these concepts. Stress as a biological response. In 1956, Hans Selye published the results of his research on the physiological response of a biological system to an imposed change on the system. Since his initial publication, his definition of stress has evolved to the quote-unquote the state manifested by a specific syndrome which consists of all non-specifically induced changes within a biologic system. This combo of symptoms has come to be known as the fight-or-flight syndrome. Schematics of these biological responses, both initially and with sustained stress, are presented in figures 1-1 and 1-2. He called this phenomenon the general adaptation syndrome. He described 3 distinct stages of this reaction. 1. Alarm reaction stage. During this stage, the physiological responses of the fight-or-flight syndrome is initiated. 2. Stage of resistance. The individual uses the physiological responses of the first stage as a defense in the attempt to adapt to the stressor. If adaptation occurs, the 3rd stage is prevented or delayed. Physiological symptoms may disappear. 3. Stage of exhaustion. This stage occurs when the body responds to prolonged exposure to a stressor. The adaptive energy is depleted and the individual can no longer draw from the resources for adaptation described in the first 2 stages. Decreases of adaptation includes headaches, mental disorders, coronary artery disease, ulcers, and colitis may occur. Without intervention for reversal, exhaustion and in some cases even death ensues. The fight-or-flight response undoubtedly served our ancestors well. Those Homo sapiens who had to face the giant grizzly bear or the saber-toothed tiger as part of their struggle for survival must have used these adaptive resources to their advantage. The response was elicited in the emergency situations, used in the preservation of life, and followed by restoration of the compensatory mechanisms to the pre-emergent condition. He performed his extensive surgery in a controlled setting with lab animals as subjects. He elicited the physiological responses with physical stimuli, such as exposure to heat or extreme cold, electric shock, injection of toxic agents, restraints, or surgical injury. Since the publication of the original research, it has become apparent that the fight-or-flight syndrome of symptoms occurs in response to psychological or emotional stimuli, just as it does to physical stimuli. Psychological or emotional stressors are often not resolved as rapidly as physical stressors, so the body may be depleted of its adaptive energy more readily than it is from physical stressors. The fight-or-flight response may be inappropriate or even dangerous in our modern lifestyle, in which stress has been described as pervasive, chronic, and relentless psychosocial state. When the stress response becomes chronic, the body's persistent, aroused condition for extended periods of time increases in individuals for risk for disease. Stress as an environmental event. A second concept defines stress as stress that triggers an individual's adaptive physiological and psychological responses. This event creates change in the life pattern of the individual, requires significant adjustment in their lifestyle, and taxes available personal sources. The change can either be positive, such as an outstanding personal achievement, or negative, such as being fired from a job. The emphasis here is on change from the existing steady state of the individual's life pattern. Miller and Ray have updated the original social readjustment rating scale, devised by Holmes and Ray in 1967, to reflect an increased number of modern stressors. Just as in the earlier version, numerical values are assigned to various common life events based on the stress these events create. In their research, Miller and Ray found that women react to life stress events at higher levels than do men, and unmarried people gave higher scores than married people for most of the events. Younger participants rated more events at a higher stress level than did older participants. A high score on the Recent Life Changes Questionnaire, RLCQ, places the individual at higher susceptibility to physical or psychological illness. The questionnaire may be completed considering life stressors within a 6-month to 1-year period. 6 months totals equal to or greater than 300 life change units, or 1-year totals equal to or greater than 500 life units, are considered indicative of a high level of recent life stress, thereby increasing the individual's risk of illness. The RLCQ is presented in Table 1-1. It is unknown whether stress overload merely predisposes a person to illness or actually precipitates it, but there does appear to be a link. Individuals differ in their reactions to life events, and these variations are related to a degree to which the change is perceived as stressful. Life changes questionnaires have been criticized because they do not consider the individual's perception of the event. These types of instruments also fail to consider cultural variations, the individual's coping strategies, and available support systems at the time when the life change occurs. American developed a tool to assess stress overload that attempts to correct for these limitations by asking a series of 30 questions that all begin in the past week, have you felt ... followed by choices such as calm, inadequate, depressed, and others. The emphasis in this tool is on the individual's perception of events rather than on the events themselves. Although the approaches to assessing for stress and vulnerability vary, it is clear that positive coping mechanisms and strong social or familial support can reduce the intensity of stressful life changes and promote a more adaptive response. Stress as a transaction between the individual and the environment. The concept of stress as a transaction between the individual and the environment emphasizes the relationship between internal variables and external variables. This concept parallels the modern concept of disease etiology. No longer is causation viewed solely as an external entity. Whether or not illness occurs depends also on the receiving organism's susceptibility. Similarly, to predict psychological stress as a reaction, the internal characteristics of the person in relation to the environment must be considered. Precipitating event. Lazarus and Folkman's seminal therapy defines stress as a psychological phenomenon in which the relationship between the person and environment is appraised by the person as taxing or exceeding his or her resources and endangering their well-being. A precipitating event is a stimulus arising from the internal or external environment and is perceived by the individual in a specific manner. Determination of an event as stressful depends on the individual's cognitive appraisal of the situation. Cognitive appraisal is an individual's evaluation of the personal significance of the event or occurrence. The event precipitates a response on the part of the individual, and the response is influenced by the individual's perception of the event. The cognitive response consists of a primary appraisal and a secondary appraisal. Individual's perception of the event. Primary appraisal. Lazarus and Folkman identified 3 types of primary appraisal: irrelevant, benign, positive, and stressful. An event is judged irrelevant when the outcome holds no significance for the individual. A benign, positive outcome is one that is perceived as producing pleasure for the individual. Stress appraisals include harm or loss, threat, and challenge. Harm or loss appraisals refer to damage or loss already experienced by the individual. Appraisals of a threatening nature are perceived as anticipated harms or losses. When an event is appraised as challenging, the individual focuses on potential for gain or growth rather than on risks associated with the event. Challenge produces stress even though the emotions associated with it are viewed as positive, and coping mechanisms must be called upon to face the new encounter. Challenge and threat may occur together when an individual experiences these positive emotions along with fear or anxiety over possible risks associated with the challenging event. When stress is produced in response to harm or loss, threat, or challenge, a secondary appraisal is made by the individual. The secondary appraisal is an assessment of skills, resources, and knowledge that the person possesses to deal with the situation. The individual appraises the situation by considering the following. Which coping strategies are available to me? Will the option I choose be effective in this situation? And do I have the ability to use the strategy in an effective manner? The interaction between the primary appraisal of the event that has occurred and the secondary appraisal of the available coping strategies determines the quality of the individual's adaptation response to stress. Predisposing factors. A variety of elements influence how an individual perceives and responds to a stressful event. These predisposing factors strongly influence whether the response is adaptive or maladaptive. Types of factors include genetic influence, past experiences, and existing conditions. Genetic influence are those circumstances of an individual's life that are acquired through hereditary. Examples include family history of physical and psychological conditions and temperament. Past experiences are occurrences that result in learned patterns that can influence an individual's adaptation response. They can include previous exposure to the stressor or other stressors, learned coping responses, and degree of adaptation to previous stressors. Existing conditions incorporate vulnerabilities that influence the adequacy of the individual's physical, psychological, and social resources for dealing with adaptive demands. Examples include current health status, motivation, severity and duration of the stressor, financial and education resources, age, existing coping strategies, and a caring support system. Holboff's conservation of resources theories add that as existing conditions exceed the person's perception of adapt capabilities, the person not only experiences stress in the present but also becomes more vulnerable to the effects of stress in the future due to a weaker source reservoir to call on to meet future demand. All of the preceding concepts and theories are foundational to the transactional model of stress and adaptation that serves as a framework for the process of nursing in the text. A graphic display of the model is presented in Figure 1-3. Stress management. The growth of stress management into a multi-million-dollar-a-year industry attests to importance in our society. Stress management involves the use of coping strategies in response to stressful situations. Coping strategies are adaptive when they protect the individual from harm or additional harm, or strengthen their ability to meet the challenging situations. Adaptive responses help restore homeostasis to the body and impede the development of diseases of adaptation. Positive adaptation has also been referred to as resilience. Responses are considered maladaptive when the conflict goes unresolved or intensifies. Energy resources become depleted as the body struggles to compensate for the chronic psychological and physiological arousal experienced in response to the stressful event. The effect is a significant vulnerability to physical or psychological illness. One key to stress management is to identify factors and practices that contribute to adaptive coping and resilience. Adaptive coping strategies. Awareness. The initial step in managing stress is awareness, to become aware of the factors that create stress and the feelings associated with a stressful response. Stress can be managed only when one recognizes the signs that it is occurring. As an individual becomes aware of stressors, he or she can choose to omit, avoid, or accept them. Relaxation. Individuals experience relaxation in different ways. Some people relax by engaging in gross motor activities such as sports, jogging, and physical exercise. Others use techniques such as breathing exercises and progressive relaxation. Mediation has been shown to produce a lasting reduction in blood pressure and other stress-related symptoms when practiced for 20 minutes once or twice a day. The practice of mindfulness meditation is foundational to many psychosocial interventions aimed at reducing anxiety and improving engagement in problem-solving situations. Mediation involves assuming a comfortable position, closing the eyes, casting off all other thoughts, and concentrating on a single word, sound, or phrase that has positive meaning to the individual. It may also involve concentrating on one's breathing or other mindfulness practices. Interprofessional communication. As previously mentioned, the strength of an individual's available support system is an existing condition that significantly influences his or her adaptation when coping with stress. Sometimes, just talking out the problem with an empathetic individual can interrupt escalation of the stress response. Writing about one's feelings in a journal or diary can also be therapeutic. Problem solving is an adaptive coping strategy in which the individual is able to view the situation objectively or seek assistance from another individual to accomplish this if their anxiety level is too high, and then apply a problem-solving and decision-making model such as the following. Assess the facts of the situation, formulate goals for resolution of the stressful situation, study the alternatives for dealing with the situation, select an alternative, determine the risks and benefits of each alternative, implement the alternative selected, and evaluate the outcome. If the choice is ineffective, select and implement a second option. Studies show that those who care for pets, especially dogs and cats, are better able to cope with the stresses of life. The physical act of stroking a dog's fur or cat's fur can be therapeutic, giving the animal an intuitive sense of being cared for and providing the individual the calming feeling of warmth, affection, and interdependence with a reliable, trusting being. Studies have also shown that individuals with companion pets demonstrate improvements in heart health, allergies, anxiety, and mental illnesses such as depression. Studies have shown multiple benefits of listening to music, including relieving pain, improving mood and performance, improving sleep, enhancing blood vessel function, reducing stress, relieving symptoms of depression, improving cognition, and easing recovery in stroke patients. Summary and key points. Stress has become a chronic and pervasive condition in the United States. Adaptive behavior is a stress response that maintains the integrity of the individual with a timely return to equilibrium. It is viewed as positive and is correlated with a healthy response. When behavior disrupts the integrity of the individual or results in persistent disequilibrium, it is perceived as maladaptive. A stressor is defined as a biological, psychological, social, or chemical factor that causes physical or emotional tension, and this may be a factor in the etiology of certain illnesses. Hanseli identified the biological changes associated with a stressful situation as the fight-or-flight syndrome. He also called the general reaction of the body to stress the general adaptation syndrome, which occurs in 3 stages: alarm, reaction stage of resistance, and stage of exhaustion. When individuals remain in the aroused response to stress for an extended period of time, they become susceptible to diseases, including but not limited to headaches, mental disorders, ulcers, and colitis. Stress may also be viewed as an environmental event, which results from a change from the existing steady state of the individual's life pattern occurs. When this individual experiences a high level of life change events, they become susceptible to physical or psychological illness. Limitations of the environment and concept of stress include failure to consider the individual's perception of the event, coping strategies, and available support systems at the time when the change occurs. Stress is more appropriately expressed as a transaction between the individual and environment that is appraised by the individual as taxing or exceeding their resources and endangering their well-being. The individual makes a cognitive appraisal of the precipitating event to determine the personal significance of this event. Primative cognitive appraisals may conclude that an event is irrelevant, benign, positive, or stressful. Secondary appraisals include evaluation by the individual's skills, resources, and knowledge to deal with the stressful situation. Predisposing factors influence how an individual perceives and responds to a stressful event. They include genetic influences, past events, past experiences, and existing conditions. Stress management involves the use of adaptive coping strategies in response to stressful situations in an effort to impede the development of diseases. Examples of adaptive coping strategies include developing awareness, relaxation, meditation, problem solving, pets, and music.